Hi everybody, this is Dr. John Hayes. I'd like to welcome you back to Beating Neuropathy and Chronic Pain here on 95.9 WATD. And tonight what we're going to be talking about, we're going to start the show off tonight talking about something that is unfortunately very, very common, something we see a lot of in our clinics, and something that you probably are very, very familiar with, and that is what has been called carpal tunnel syndrome. Carpal tunnel syndrome is a form of neuropathy. Basically what it is what's called an entrapment neuropathy, which means a type of nerve insult, if you will, or nerve damage or irritation that comes usually from mechanical compression. Carpal tunnel syndrome can also result from a complication of diabetes, anything that causes fluid retention or swelling, which is one of the reasons that carpal tunnel symptoms are common in pregnancy. They're also common in athletes, bicycle riders, motorcycle riders, basically people who use their hands repetitively. Interestingly, it actually seems to be a myth that keyboarding or excess computer work precipitates carpal tunnel syndrome, because the studies just don't bear that out. In fact, there's a good study that was done at the Mayo Clinic that showed that keyboarders or frequent keyboarders didn't have a significantly higher incidence of carpal tunnel syndrome than the average population. But what makes carpal tunnel syndrome such a problem, I think, is twofold. And I'll talk about this kind of in general terms, and then we'll get into some of the specifics, because they're important to understand. First of all, when we speak about carpal tunnel syndrome in the clinic, we're talking about a patient who presents usually with tingling, numbness, burning, and that type of thing of the outside of the hand, basically the thumb, the forefinger, and usually the third finger. Sometime the inside or the outside half of the fourth finger could be involved too, but usually what's called the median aspect of the hand. And what's causing true carpal tunnel syndrome is irritation of the median nerve, which is one of the large nerves that comes out from the shoulder, crosses the elbow and then down into the wrist. Well, at the wrist, the median nerve tends to become entrapped. And when the median nerve gets entrapped, again, patients will have symptoms like tingling, numbness, burning, pain, and that type of thing. One of the interesting things to note, and this is one of the most important things to know about carpal tunnel syndrome, is that there are other conditions that can mimic carpal tunnel syndrome. In other words, just because you have the symptoms, meaning tingling, numbness, burning, in the outer aspect of your hand, does not necessarily mean you have carpal tunnel syndrome. You could have what's called thoracic outlet syndrome, which is entrapment of nerves higher up, usually at the shoulder level, or actually specifically at the shoulder level, and there's a whole host of other things that could be going on. Very often the patients that have issues with their neck develop these symptoms of carpal tunnel syndrome. And the reason I mention this is that it is a well-known fact that before you or a loved one ever undergoes surgery for carpal tunnel syndrome, you want to make sure that your physician has explored everything else that may be going on. It's relatively straightforward, relatively easy to do in the clinic with a good neurologic examination, and then there are other tests that can be done to to help diagnose carpal tunnel syndrome. Things like EMGs and nerve conduction studies, which are tests that are usually done by a neurologist, can be very, very helpful in telling us if you do have carpal tunnel syndrome. But one of the reasons it's very, very important is that we do know, when we look at large groups of patients who have undergone carpal tunnel surgery, in the large groups, in some of the studies that were done, a significant number of patients did not have relief after surgery. And those patients that didn't have relief after surgery, usually it turned out not because the surgery wasn't successful, it was because the patient had some underlying or other contributing factors, namely issues with the neck and the shoulder. So those are things that I think are really important, to understand about carpal tunnel in general. And then what we'll do next is to talk a bit more about the specific things that we see and we hear from patients who suffer from this very, very common condition. There's about 5 million or so patients in the United States alone that suffer from carpal tunnel syndrome on a regular basis. And commonly, in addition to the things that we said earlier, shooting pains, and the shooting pains can be at rest. One of the classic things about carpal tunnel syndrome is it will tend to wake patients in the early morning hours. In fact, that's one of the things that helps us make the diagnosis. That's kind of one of the things we look for that separates the fact that you may, in fact, or the fact you may be suffering from carpal tunnel syndrome versus something else is being awakened in the early morning hours with the tingling, numbness, and burning of the hand, sometimes both hands. And also, you may experience some shooting pains, you may experience pain during some activities, and so on. The thing to understand is that usually, with rare exception, carpal tunnel syndrome is not really associated with extensive nerve damage. Carpal tunnel syndrome is usually something that in the healthcare professions we call a neuropraxia, which means basically an insult to the large nerve itself. And this insult to the nerve, which is usually from swelling or compression or repetitive use or trauma, injury, that type of thing, when that type of situation has occurred, what happens is that the area that's supplied by the median nerve, namely the thumb, the forefinger, and the middle finger in particular, will start to experience the things that we mentioned earlier, like the tingling, the numbness, and so on and so forth. So when we come back from the break, what we're going to do next is to talk a little bit more detail about what the carpal tunnel actually is, where it is, and what you can do to not only help yourself or a family member with carpal tunnel syndrome, but what you can do to prevent it. You're listening to 95.9 WATD. This is Beating Neuropathy and Chronic Pain. We'll be right back.